Hey guys, I'm a regular red blood cell. I'm here to talk to you about 3 different types of anemia: macrocytic, microcytic, and sickle cell anemia. Anemia affects the production of red blood cells, which are vital for the transportation of oxygen all over the body. Anemia can be caused by blood loss, malnutrition, or a hereditary condition. I'll discuss the symptoms, causes, and treatment for each of these diseases. First, we'll talk to you about macrocytic anemia. Mac is a big red blood cell. Actually, he's too big. MAC mostly shows up when a person has a vitamin B12 deficiency, and he can also be caused by alcoholism, certain stomach problems, or pregnancy. Symptoms include neurological disorders, headache, fatigue, and gastrointestinal symptoms. MAC can be brought down to his normal size by adding vitamin B12 supplements to the patient's diet, and sometimes blood transfusions are required. He's a big guy. Next, we're going to talk about microcytic anemia. Where's Mike? Mike! There he is. Microcytic anemia occurs when there is a lack of iron in the body or iron cannot be properly absorbed. Notice the size and color of Mike. Mike is smaller than a normal red blood cell and is lighter in color. When the body lacks an adequate amount of iron, it affects the body's ability to produce healthy red blood cells. Microcytic anemia can be diagnosed with a blood test. Symptoms include fatigue, paleness of skin, shortness of breath, dizziness, inflammation of the tongue, as well as difficulty swallowing. Microcytic anemia can be caused by excessive blood loss, pregnancy, unhealthy dietary habits, and problems with iron absorption. Mike can grow and brighten up once the iron deficiency has been fixed or blood loss has been stopped. Next, we got a real serious guy. Here he is. Sickle cell anemia is a hereditary disease that causes red blood cells to be produced with mutations. Because the cells are C-shaped and sticky, they do not flow through the vessels as easily as healthy cells. When clumps form and block vessels, pain, organ damage, and infection can occur. A blood test is necessary to diagnose this disease. Blood transfusions can help prevent clogging of the blood vessels, but acquiring toxic amounts of iron in the body is also a risk. A prescription drug called Droxia is prescribed for adult patients to reduce frequency of severe pain. There is not an approved dose for children. Let's call everyone back out here before we say goodnight. We got Big Guy Mac, Shorty Mike, and our twisted sickle cell. Thanks for coming, cells, and we hoped you enjoyed our show.